So you wake up in the morning, set up out of bed, put your feet down on the floor, and the first step you take, it's like, it feels like somebody just stuck a hot poker to the back of your heel, and it really hurts. You could be suffering from what is called plantar fasciitis. Typically, that's a heel in the pain as you start to step. I bet you've even tried everything from orthotics to thicker sole shoes. Maybe some of you had injections in your feet, and it just keeps coming back. Well, today, I'm going to show you how to solve that problem in just a few minutes a day. Hey, I just want to say thank you to everyone who's been subscribing to my channel, and I got a great announcement to give you. On September the 1st, 2024, my first book on stretch and release technique will be coming out. And we're going to have some pre-sales promotions going on in August. So look forward to that, and I'll keep the announcements coming with that. But please, if you haven't subscribed to the channel, please subscribe to the channel, because what you learn in the book, you can also use with the videos off of the channel to help you better understand how to take control of your health and stop this craziness with these chronic aches and pains. Thank you. Welcome back to the Muscle Repair Shop. Today we're going to talk about plantar fasciitis. Now I know that's a very common term, but for so many people, when you say to them, what is it? Most of the time they'll say it's a heel pain that I have every time I take a step. So let's get into what is it, what causes it, what are some of the typical treatments that have you tried and have probably failed, and then we're going to get into something I'm going to show you how to do a few minutes every day you'll get rid of it just like that. So let's dive right in. So what is it? So we all know that it's the heel that creates the pain here, that has that pain. But what actually causes that to happen? So when you look at the muscles of the foot, you have a muscle in the arch of your foot called a plantar fascia muscle. Plantar fasciitis was named for that. All they did was add itis to the end, meaning that the plantar fascia muscle is inflamed. It's partially true. What caused that muscle to become inflamed is where we miss the whole mark. So when you look at the calf muscles on the backside of your calf, you have 4 muscles there that control your foot vertically, laterally, and rotationally. And those muscles come down from just above the knee, down your leg, and into underneath the heel into the plantar fascia area. So when those muscles get tight, what happens is that it starts to make it difficult for you to extend your heel down flat, which overworks the plantar fascia muscle on the arch of the foot, which causes that muscle to become inflamed. That's what's happening. So when we start trying to treat that, most of the time it's treated by, you'll have orthotics, you may put a heel pad in your shoe, you may get injections in your heel, you may put ice on your heel, and in some cases even surgery has been done on people's heels as well, trying to resolve that issue. But here's the problem. The problem is that the cause is not at the heel. Yes, that's the pain, but that's not the cause. And anyone who's listened to my videos know that I'm big on the cause. I don't treat symptoms, I treat the causes. And that's what we want to dig into today. So when you look at things like a heel pad, it cushions the heel. It does alleviate some of the pain. And that allows you now to walk around a little bit better, but you know that you're not going to be able to walk barefoot ever. And over time, the heel pad will stop working. Then the arch of the foot can start to get sore, so then usually they'll move you up to an orthotic. The orthotic then stops that arch pain because it's supporting the arch, preventing it from flexing like it's supposed to absorb the impact to the ground. And by doing that, now that muscle in the arch starts to atrophy. And so over time, walking barefoot, especially on a hard surface, is very difficult. And many times your physician may say to you, never walk barefoot on a hard surface. If the plantar fascia muscle is healthy and soft, you could walk on any surface you want because you were designed to do that. The injections, again, they're going to be a pain reliever. It's going to slow down the inflammation. It's going to reduce the pain that you feel there, but you still have to wear shoes, especially thicker sole shoes, to make that happen. And here's the funny part about that. The thicker sole shoes that we're told are supposed to be good for our feet, in actuality can contribute to you getting the plantar fasciitis. Take that as an inside joke, I guess. So there's some things here that we're going to do that I'm going to show you today that it's just a few minutes a day. You'll be able to solve this, and you have to do it daily for a few days, but you do it first thing in the morning, last thing of the day. The only thing you need to do that is the floor or a hardback chair with an ottoman, a yoga strap or a rope, and I promise you, you'll be amazed at how fast it's gone away. I don't care if you've had it for months. I mean, I've had people come to see me who's had it for 4 and 5 months, and within 1 to 2 visits with me and them doing the work at home, it was gone. So let's dig right in. Okay, so now I'm going to demonstrate this sitting in a chair with an ottoman, but you can also do this sitting on the floor with your hips and back against the wall. The purpose of the wall, the purpose of the chair, is to keep my torso at 90 degrees to my leg. The ottoman here gives me the chance to put one leg up on the ottoman just like this here, so that I can take my yoga strap or rope, whichever one you have, just make sure it's not an elastic band, and take it around the ball of your foot here. I'm going to stretch my calves in 3 different directions because remember, as I said earlier, the calves have 4 muscles back there. They control the foot in a vertical movement like for walking, lateral movement like for balance, rotational movement like for bending over and picking up things at an angle. Or as a side note, if you play golf or any sport with a racket or a bat, the rotation of the ankle is going to be key to stopping low back pain for you at that time. So when you're doing this and you're gently pulling back, you're going to feel the stretch more up behind the knee. Most of my life as an athlete, I thought that meant my hamstrings were tight. That actually means that my calves are tight, which is insane when you think about it, because I've been working so hard on my hamstrings and nobody ever said anything about my calves. So again, as we start here with the strap, what we're doing is we're inhaling through the nose before we start, and as I pull my toes back towards me, I'm going to slowly breathe out like this. Hold for that 5 seconds, release it, and then come back and do it again. Now notice that I'm not pulling so hard that I'm pulling my leg up like that because I don't want to do a bicep curl. And I'm not pulling so hard that I'm also using my muscles in my legs up here and my shins to help pull my toes back. That's not the whole goal at all. It's like you can move your torso forward slightly if you want more intensity. But again, we're not trying to make the muscle do something. What we're doing with the inhale and the breathing out is allowing the mind to relax so the muscles can relax. And as the muscles relax, you'll feel them giving in, and each time you do it, it'll become easier. Now you're going to do it in this direction 10 times. Once you're done, you're going to rotate the leg over so that the foot goes inward. Do the same thing again 10 times. Again, inhale, and as you pull back, and you'll do that 10 times. The mind plays a massive role with your muscles. And so as you come back, that breathing out, you're relaxing the mind so that the muscles will relax. If you're worried about hurting yourself, or if you're worried about how well you're doing it, or you're worried about being perfect, your muscles will tighten and you're not doing anything but using your mind for thoughts. Once you're done with the 10, rotate the foot outward. Now you're going to feel the stretch more to the inside of the calf. So you got 3 directions. The one in the middle for the middle calf muscles, rotate the leg in. For the outside calf muscle, rotate the leg out for the inside calf muscle. I would do 1 set of 10 of these every morning after you wake up and every evening before you go to bed. And I'm telling you, you'll be amazed at how much your calf muscles will straighten out for you and your plantar fasciitis will disappear before you know it. Now, the next thing that I'll do is massaging my feet every night. And my wife could tell you if she was here, I work on my feet every night while I'm sitting with her talking or watching TV or whatever, because I want to keep my feet nice and soft. So like the name implies, plantar fasciitis means that the plantar fascia, which is a muscle right here into the arch of the foot, is tight, and it could be painful. So you want this part of your foot to feel the same as the palm of your hands, and hopefully your hands are soft too, otherwise you have hand pain as well. But I'm going to assume that your hands are pretty soft. So you want to feel into the palm of your hand like that, and your foot should be very similar. But when you press, so let me get it here where you can see, when you press the foot here, what you want to do is take the pads of your thumb, press in. Now most people, when I talk about massage, they want to do this kind of thing. That's a rub down. That's not a real massage. What we're doing here neuromuscularly is that we're taking the pads of our thumb and we're just pressing one spot at a time, you see. And as you press there, some spots will be painful and some spots you'll feel nothing at all. When you find a spot that is a little painful, the temptation is to push really hard to push this out. Don't do that, because once you increase that intensity on the pain, the brain then looks at it as an attack, even though it's you doing it, and will tighten the muscle to try to stop the pain. What you want is when you find a painful spot is to stay there, maintain the pressure, don't increase it, inhale through the nose, breathe out, and again, let the mind relax, and the muscles will relax right underneath your thumb. And as you practice this, you'll start to feel them letting go and realize it's your mind that's holding it more than anything else. And then once it stops and the pain stops, go to another spot. And you just keep working all over the arch of the foot so that that arch can be as soft as the palm of your hand. On the top of your foot, like right into here, you can feel the bones right there on the top of your foot. So what you're doing here is you're taking your fingers and you're literally running right up the foot, right between each of those bones. Now I typically do it about 3 to 4 times. Again, for some of you, when you first start doing this, this may feel painful. Don't try to push it all out in one time. Take your time with it. When you get here and it feels a little painful, put just enough pressure you can feel it, but not so much pressure that you can't breathe. Breathe out and allow that to let go. Come between each of those bones here and the metatarsal bones here. Work your way up towards your ankle. Your foot should be very thin. It shouldn't be really thick. It should be very thin. And the importance of that is when you step down, the arch of the foot can expand to absorb the impact. Toes can wide for better balance. And then you can grip the ground and you'll stop your plantar fasciitis. I'm telling you, I've done it hundreds of times with people of all ages, from 15, 16, all the way up to 95 years of age. And it's worked every single time. So give it a shot. Let me know how it's working for you. And again, don't forget to subscribe down below, ring the bell, and again, leave your comments. I love talking to you. And for now, see ya. I hope you enjoyed this last video. Be sure to click on the video here to my left and enjoy.